Hello, good evening, good afternoon, good morning, good day, wherever you are in the world, and welcome to the Black Belt Academy of Surgical Skills. My name is David O'Regan. I'm a professor in the Medical Education Research and Development Unit in the Faculty of Medicine at the University of Malaya. I'm a retired cardiac surgeon and immediate past director of the Faculty of Surgical Trainers for the Royal College of Surgeons of Edinburgh. We are delighted to be on a new platform with iEcho, and Dr. Apragina is the producer in the background in New Delhi, and it's currently 44 degrees and very humid, apparently. We are exploring with the Black Belt Academy basic surgical skills, but mastery is attending to the basics all the time, with no exception. This is an opportunity for you to ask questions, for me to demonstrate low fidelity models that I hope will encourage you to practice at home to hone your surgical skills. Last week, we talked about Mackindou, not Mackindou, Lord Barclay Moynihan, and the infinite gentleness that you need to apply to the tissues. He was extremely good with words and a fabulous orator, but there's another fantastic surgeon who was born in Dunedin on the 4th of May, 1900. Archibald Mackindou graduated from the University of Otago Medical School in 1923. The following year, he was awarded the first New Zealand fellowship to the prestigious Mayo Clinic in the United States. And over the next 4 years, he did a Master in Science degree and published several papers on chronic liver disease. When his fellowship ended in 1928, he was appointed assistant surgeon at the Mayo Clinic, where he developed a reputation for a quick-thinking and skilled surgeon. With his star on the rise, Mackindou was encouraged to pursue his career in the United Kingdom, and he moved to London in the 1930s. Opportunities were scarce, and after a period of unemployment, he contacted a distant relative, a fellow New Zealander, Sir Harold Gillies, in an effort to secure work. Now, Gillies was a renowned, noted plastic surgeon of the First World War, and he invited Mackindou to join his private practice and offered him a position at St. Bartholomew's Hospital in London. And under Gillies' tuition, Mackindou quickly became a leading figure in the field of plastic surgery. By the outbreak of the Second World War, there were only 4 experienced plastic surgeons in the whole of Great Britain, and Mackindou was one of them. And he took up his position at the Queen Victoria Hospital in East Grinstead in Sussex, where he established a centre for plastics and jaw surgery. The centre treated airmen with facial disfigurements and serious burns, and many of his patients arrived with deep burns to their faces, hands, caused by exploding aircraft fuel, an injury dubbed the hurricane burn by the pilots and the aircrew. So as the casualties of war came flooding in, it became clear, certainly in the Queen Victoria Hospital in East Grinstead, where Mackindou was working, that the volume and severity of injuries would be unparalleled, unlike anything the hospital had ever dealt with before. So a special ward, Ward 3, was allocated for his patients, and the majority of injuries, as I said, were caused by fuel tanks being ignited, engulfing the crew in flames, and despite wearing heavy-duty flying jackets and trousers, their hands and faces in particular were exposed to the fierce heat and bore the brunt of the inferno, causing terrible, life-changing injuries. Now, before 1939, burns victims rarely survived the injuries, And Mackinder realized early the woeful inadequacies of burns and plastic surgery treatment. And he devised new ways to treat burns, including the use of saline to bathe them, because he noticed the pilots who had ejected and landed in the sea fared a lot better than those who landed on the land. This is one element that I thought was fantastic about this man, his power of observation and his curiosity. He also secured the banning of tannic acid. Now, tannic acid was routinely used to treat burns with disastrous consequences. In fact, what it did was dried out the burns to leave an eschar, which was then peeled off with tremendous difficulty, pain, and disfigurement. During the Battle of Britain, 35 burnt pilots were sent to Mackinder for treatment. And tannic acid was used, but he banned it because it left painful and wicked scars. Using saline proved a much better and gentler treatment and improved healing times and survival rates for patients with extensive burns. As well as developing innovative treatments and surgical techniques, which included formulating flaps from forearms and faces to create new noses, eyelids, and ears. He recognized the importance of rehabilitation. He recognized the psychological effects of the burns of his patients, and he championed their rehabilitation in the community. And he encouraged his boys to form their own guinea pig club. And I was interested to read about 7 years ago in the Sunday Telegraph magazine that the guinea pig club was being disbanded because it was down to one survivor. But they had been meeting ever since the end of the Second World War. And he made sure that his pilots retained their proud identity by wearing their service uniforms instead of the hospital convalescent uniforms. And there was particular emphasis on ensuring social engagement and back to normal life. He is referred to as the maestro or the boss. And he'd regularly join his patients in social events inside the hospital, take them out for drinks to the pub, and encourage them and encourage the community to welcome them. The effect was amazing. The relationship between the nurses and the patients blossomed. Indeed, I'm told that he would only employ good-looking nurses because he was anxious to ensure that the esteem of these young men was maintained. Many of them went on to get married, and apparently there's quite a lot of hanky-panky going on in the cupboards at East Grinstead. East Grinstead was known as a place the guinea pigs referred to as the town that did not stare. And the first accounts of the guinea pigs themselves tell of Sir Archibald Mackinder's tireless determination to ensure that none of his patients would experience prejudice, discrimination once they left the hospital. He hosted seminars and lectures and arranged concerts and sporting events in the grounds, visited local pubs and encouraged the town to welcome these young men and not shun them. And that is the other important thing I like about this man. He was not just a surgeon. He was a human looking after the holistic side. And that is what good surgery is all about. We cannot underestimate the psychological damage that is done. And he did all of this to boost their mental well-being and encourage them to wear their uniforms with pride. Sir Archibald Mackinder described the Guinea Pig Club as the most exclusive club in the world. But the entrance fee is something most men would not care to pay, and the conditions of membership were arduous in the extreme. It's no wonder he became known as the boss. And asked if he'd always been such an outstanding surgeon, he simply said, good, competent, experienced, yes. But when I looked at a burnt boy for the first time, and I saw that I had to replace his eyelids, God came down to my right arm. He won international recognition for his pioneering work at Queen Victoria Hospital. He was knighted in 1947, and he retired and took up farming in East Africa, where he helped establish the African Medical Research Foundation. Back in Britain, he was involved in founding the British Association of Plastic Surgeons and later served as president. He died on the 11th of April, 1960, at the age of 69, and he was cremated and his ashes were buried in the Royal Air Force Church of St. Clement's Danes in London, the only non-military person to have that honor. His legacy lives on in the Blonde McIndoe Research Foundation, which was opened by the Queen Victoria Hospital in 1961, and to this day continues to do research in treatments to improve wound healing. Truly a remarkable man. And he described this wonderful pair of scissors for dissection. And it saddens me to see some people don't hold them correctly and don't offer them due respect. Now, scissors have been around since ancient times, usually a combination of one blade hinged to another as a pair of shears slicing over each other. And it was the Romans that put a hinge in it, as we know today, to end up with what we recognize as scissors, which is an unusual name because it is a word that is in its plural, like trousers, clothes, or spectacles. There's no singular for scissors, and it's what's called a plurale tantum. Scissor skills are recognized in primary school. And at the age of 2, you take a pair of scissors and you should be able to cut a piece of paper. By the age of 4, as a developmental skill, one should be able to cut shapes, squares, triangles, and circles. And by the 5th grade, you can use a 7-inch pointed pair of scissors, and your cutting skills should be more sophisticated. I was given a set of scissors, Chinese scissors, because there's an ancient art of cutting shapes with scissors. And cutting things out in card with scissors is still a skill that is worth trying. Now, I would actually say, take a bit of McIndoe scissors, and I'm not going to do it on this card because it's too thick and I haven't found it, but take a shape on a piece of paper, place it on a table, hold the piece of paper with a pair of forceps, and see if you can cut out a shape accurately. In the Black Belt Academy, our basic skill is to cut out a square and cut out a circle, a black square and a black circle, and you put it against a white background, you can see how much you got left over. In essence, you want to be able to cut it in smooth without leaving any jagged edges, which comes down to how we actually hold the scissors. Although, firstly, we've got McIndoe scissors, Metzenbaum named something that looks very much like a pair of McIndoe scissors, but somewhat chunkier. And of course, we have the longer version, the Nelson scissors. There are many other types of scissors with specialist functions, pot scissors, vascular scissors, and we've asked you to name some. But let's take you over and show you how we should actually hold a pair of scissors. I'm just trying to actually increase my screen so I can see better. and it's not going to do it for me, unfortunately. But there you go. So, as I've said previously, the principle of holding a pair of scissors or holding any surgical instrument, and as alluded to by Lord Berkeley and Moynihan, you need to feel the tissues. And feel can only happen, as we said previously, by the fingertips. And as a rule of thumb, excuse the pun, the more surface area of the tips of the fingers you apply to an instrument, the better you'll feel. And I would say that applies to all the surgical instruments. So in holding the scissors, you'll see here, we don't put our fingers through the joints. Many people hold scissors. Some of them hold them pterodactyl style, like that. Others put it on the ring finger and hold it, but the DIP joint is through. Don't know why, but a colleague, Linda de Carside, noticed that I too put my thumb and my ring finger and apply those to the rings. I don't put my finger through, but I'm placing my finger obliquely on the ring. And this is important also if you've got small hands. Placing your fingers obliquely enables you to feel the tissue. My middle finger is supporting that hold, and my index finger is extended down the instrument, giving me direction and proprioception. And you can see the position. I'm not grabbing this. It's simply resting in my fingers. I'm not gripping. If you start seeing blanching of my fingernails or blanching of my thumb, I'm gripping it too tight. That does not become feel. And dissection, especially with scissors, requires that you feel the instrument and it becomes an extension of your hand and fingers. There are many numerous cognitive studies that looked at this phenomenon and is being explored to a great deal at the moment, particularly by a group in Harvard, because they're researching the haptics of robotics. Not surprisingly, the haptics and feel is the last of the senses to be fully understood and appreciated. It is certainly not as simple as you think, but it all happens because you have got the palp of the finger. And there's more sensory information going from the palp of your fingers to your brain than there is from the eye to the brain. So lightness of touch, balanced on the fingers, finger down. Now, the other important element of the scissors is the curve. All right? You can see there the curve. Now, as I look down this pair of scissors, and you look down, you can see the belly, and you can see the point. If I turn it up the other way and hold it, you can see the point. You can't see the deep part of the belly, the curve here. That's holding it like a spoon. And the problem with that is you will not be able to see what the belly's doing. And I've seen the pulmonary artery cut as somebody has moved the scissors through. So hold it with the curve of the wrist, with the curve of the scissors, and therefore your dissection becomes appropriate. So we have a number of models here to demonstrate to you and the function and purpose of the scissors. And I've asked in questions that are put in the chat, what can you do with a pair of scissors? And quite frankly, you could do almost everything with a pair of scissors. And I have some sausages here. Here we go. Now, I use sausages because they've got a skin. You see the skin there? I'm going to open up that skin. And the skin is not unlike the tissue planes that you will come across, particularly in solid organs, because the vessels invaginate into the mesenchyme. So your job now is can you develop a plane under that skin And I'm going to focus that further so you can see exactly what I'm doing. Here we go. I know I've got my scissors upside down, but I'm opening and withdrawing. And that's the first principle of separation. You've got to see open, take out, close. You never close the scissors in an area where you can't see. Open, take out, close. So I'm not cutting, but what I need to do is find that plane and try not to disturb the sausage meat underneath. Note, I'm not opening the scissors any more than a few millimeters. I'm not opening them wide like that. And as I open them, I'm feeling the resistance and feeling the tissues. Once you're in the right plane and lifted it clear, as you'd find in running your scissors along the adventitia of a vessel to clean it off, if you hold the tip up, see that? I can run along and lift off that membrane. Now, my scissors have become a sort of an instrument to allow me to gently develop the plane. They're blunt. You certainly wouldn't do that with a sharp pair of scissors like this. You'd stick it in. But with these blunt scissors, I can gently tease away and develop this plane further. Of course, with this, and we will be covering it in our next session as well, what are your forceps doing? And the forceps are assisting and helping, and there's an interdependence of action, which we'll practice and talk about in further sessions. But what I love about these low fidelity models that you can get in the supermarket, they show you when things are going wrong. You can feel it. Not only that, you can see it as well. So I love the sausage model because that to me is, in vascular surgery in particular, all about developing planes. And cleaning off a vessel, whether it's a long saphenous vein or femoral artery, or any of the arteries, getting into the right plane and opening it up. And that's how you can trace and dissect a plane into a solid organ, by following the vessels. And certainly when you're going around the lung, imagine that this was alveoli and lung tissue. Yes, it is that fragile. And if you cut it, there's nothing more persistent and irritating than a nasty air leak. So again, I'm using the curve of the scissors, and I'm actually able to develop the plane. It's one of my favorite models. You can choose different types of sausages. The thinner the skin, the more challenging. The thinner the skin is the more challenging. There you have it. And you can see how much meat I leave on. The other thing is part of dissection. You see my scissors running underneath? You can clearly see there's nothing underneath that. And when you develop a plane, you run your scissors underneath and you've exposed the plane. Putting your scissors underneath demonstrates to you. And if you run them along gently, a bit like running your fingers along the back of a rough surface, you can feel any irregularity. And that could be a nerve or a vessel, but simply stroking your tissue along. So the scissors now have become an instrument of exploration, to explore the tissues. One of my favorite exercises, to be honest, is the tangerine. Now, the idea behind the tangerine is we really do need to dissect and separate the tissues. And when it comes to a very thick cortex like this, I like to use some heavier scissors. And this is where the Nelson scissors come in useful. And in my practice, using these in the pericardium to develop a layer. Again, simple principle. Open, withdraw, close. Open, withdraw, close. Find the plane, keep the point up, and can you take this off? And this thick cortex, again, is not unlike the cortex you get with pericarditis or a cortex on the lung after pneumonia or infection. And the idea is to try and cut the skin off without causing any damage, you guessed it, to the flesh underneath. It is solid tissue. There's a temptation there to force your scissors into the space. But in doing that, you would spill a lot of juice. The equivalent in operating of damaging the tissue underneath. I use heavy-duty scissors for this role because the cortex is very thick indeed. But the curve actually is quite nice for fitting around the curve of the tangerine as well. Try it yourself at home. Now, you can start off with a relatively easy tangerine where the skin comes off very easily. I asked my wife to kindly pick this up in a Giant supermarket earlier. So there was no cheating and no pre-selection. And I've certainly got a challenging cortex dissection here to take the skin off. Making progress now. What I'm then going to try and do is, having taken this cortex off, identify a segment, and the next thing is to try and separate a segment of this out. So I can see the one there. I think I need to remove, and in the interest of time, I'm just going to peel this a little bit off here to expose a little bit more. But the thing is, when you're doing dissections of cortex and things, you can't peel it off with your fingers, and there's no time. It takes as long as it takes to dissect it off. So now, is it possible for me to find and separate this tissue? And this is to try and take this cortex off. Now the pith, and identify a segment. And this literally is the sort of level of cutting that is required for a pericardectomy. It's tantalizing to just start plunging your scissors in, but you do that, you're going to end up with a lot of spilt juice. Notice if I open up too far, again, I'm going to disrupt the segment. And sometimes tissue planes are so difficult. It is difficult to determine a tissue plane. There's a tissue plane here that I'm going to use perhaps. Because on this side, it seems rather difficult. I've got a feeling there's a plane there. And it is a nibble-nibble. Possibly. Possibly. But this is for you to practice yourself. And what this exercise is doing is teaching you, one, patience, two, feeling of the tissue. Because I don't want to come in and rip this apart. And I've got a feeling I might be in the wrong plane there. I think I am. That is looking like it's in the wrong plane. I'm going to come down this side. Again, in the interest of demonstration time, we got a plane now. And this is also a question of feeling and understanding the tissues and understanding the anatomy. And there's some segments, when you dissect out, are quite clear. Other segments are not clear. So this is definitely one of the more challenging. Oops, a little bit of bleeding there. Getting there, isn't it? Yeah, getting there. And I'm just gently separating the tissues and trying to develop the planes. You can see if you actually apply your scissors too hard, you still start getting lots of juice coming out. If I fall out of picture, do say, because I'm concentrating on the model and I can't keep an eye on the screen as well. So please speak up if I fall out of picture. So there, I did slightly off the plane there, but I'm back on plane on the side. Trying to lift this out now with my scissors. We're almost out. Almost out. But I'd like you to try this yourself. I must say this one has been a challenge. Definitely. There you go. We have got a segment out. but I've broken the segment down this side. And I suppose in some respects, no excuse. I'm just mindful of the time and wanting to demonstrate other models. But you should not operate according to the clock, as we said last week. You operate according to the feel of the tissues. And it takes as long as it takes. And some of these operations do take a very long time. And the great thing about scissors, it enables you to operate at depth. So there you can see on this side, I entered the wrong plane there. But that's the orange segment out. You can look at the segment at the end and see where did you breach it on either side. Segment's intact on that side. Segment there, that was sticky, but it's largely intact. And on this side, that looks good, but I've damaged it there. Now, if you want to go further in your dissection, in fine dissection, and this is quite useful if you're using another citrus fruit like a grapefruit, but you can see here, you've got another skin, haven't you? You've got another skin. So can you now take the skin off the flesh itself without totally macerating? Now, the easier one is, to be honest, is a grapefruit. But there we go. We're starting to get the skin off, you can see. There it is there. And can you actually dissect that skin off and develop the layer? So all of these organic models are giving you feedback on the dissection skills, because you can see real time if you're macerating the flesh of this tangerine. And how do you learn feel? Well, if you hold the scissors correctly and you're practicing, you'll start realizing how much force you need to put in on this. So there you go. Cutting off the skin of a tangerine. Bit like we did on the sausage. But now, again, you've got another opportunity to look at your feedback and see the layers. And you see these thin layers? Well, that's exactly what tissue layers are like. And certainly, I remember my time in general surgery doing herniotomies in babies and young children. This, by comparison, is quite thick. And there you go, deliver the pip. Lovely model, had lots of different layers to dissect out, from the skin to separating the segments, and just to demonstrate what rough separation would look like. If I put my scissors in and went like that, you can see it starts ripping the tissue. Doing that rips. You want to be able to find these tissue planes and separate them out. All right? And that is what I think the fabulous part of using a tangerine or an orange to cut. So let us move on, because sometimes we're working down very deep holes. And here I've taken off the tip of a pepper or capsicum. Now, if I put my hand down like that, if I put my hand in like that, you can't see, I can't see. So therefore I have to think, well, how am I going to hold the scissors to work at depth? And what sort of movement can I get like that? Well, you hold it in the inverted form. An inverted form, one sees that I've got now it held between my index finger and thumb. My ring finger is still applied to it. Fourth finger is applied, and now the stabilizing one is my baby finger. And look what a difference it makes to operating now. I can now operate at depth. You can see it, I can see it, and I can now nibble these and cut these pips off at the bottom here at depth. When you open up scissors a little bit like that, just a few millimeters, I can use it in a scraping action. You see that? I am now scraping these pips off the inside of this pepper. So it's another function of the scissors is to scrape. Dissect them off or scrape them off. It's a gentle way of dissecting. Let me see if you can focus deeper in the hole. There you go. You can see, but you see my hand? I can now move my hand around like this. And at all times, I can see the belly and I can see the tip because I'm holding it in what I refer to as the inverted ENT bit. And looking down there, I'm not an ENT surgeon, and those ENT surgeons might say, that's not too dissimilar to peering down the nose and looking at the turbinates in the nasal cavity, I'd imagine. Not that I've ever operated in that area, but the point being that I've got a very confined space and need to operate. Of course, you can make it difficult for yourself by putting a sausage in the bottom of a glass and dissect the skin off, doing it that way. So when it comes to actual real flesh and dissection, the advantage of a pair of scissors, it allows you to dissect in confined spaces. And what's useful for that is to look at tissue layers and spaces and vessels and things. And there's nothing better than going to the butcher's and getting a piece of chicken. So this is from a piece of chicken downstairs. You can see these lovely thin layers here. And we can explore and dissect them off. Again, as a mechanism of learning to feel your instruments. I'm going to take that off and can use the scissors to open, take out, close. And when you know your anatomy, you can develop tissue layers and planes extremely quickly. And we'll have a session where we look at dissection and the art of dissection itself. I find those scissors are a little bit, need some tender loving care and maintenance and oiling. But let's see, we can develop this. It looks like, I was hoping we could see perhaps a vessel underneath here. It looks like a vessel. See how thin those layers are. There you go. Loose areolar tissue. There's a layer. And it certainly looks like there's a vein or vessel there. Or is that just the edge of the muscle or vessel? So again, there's a thin layer on top. We'll focus down a bit further so you can see that layer. And you can appreciate now, actually using a bit of chicken, you can appreciate that some of these layers are very thin indeed. think I've got a lump of bone there. I was trying to find a vessel to demonstrate one other skill. And that's all onto bone. So we'll have to wait till we dissect out the femoral canal when I've got the leg and thigh. Okay, when you're in the right plane, look, it just separates. And I can put my scissors behind and say, oh, look, there's a vessel there. Okay, you can see it, but I can feel it as well. Okay, so I'm going to clean that vessel off. Let's see if we can demonstrate what to do. We said that we should look at tying these off, and somebody would actually get something separate to pick it up, but I just wanted to see if we can demonstrate this little skill. Is I can use my scissors to catch and pull a suture through. Now, because I've got my scissors sitting on my ring finger, there you go, I can flip it out the way, and then I'm in a position to tie a knot. I don't practice that anymore because of cardiac surgery. Is a bit like karate, is an empty hand, but you can tie a knot and use to bring the scissors back in. And you don't open them any further than necessary to do the job and cut it. So being on your ring finger enables you to use your fingers to explore anything else and literally like a switchblade, bring your scissors back into play. So from an instrument point of view, this has got to be one of the most versatile instruments to enable you to dissect out tissues. And the thicker the tissue, then you'd use strong Mayer scissors to cut through tendons and separate. But I hope you get the idea of what the scissors can do and how useful they are to the surgeon in dissection. What I would like to end with is that Sir Archibald Mackinder was more than just a technician. He had a curious mind. He noted and observed that the pilots who fell into the ocean did better than those who did not. He had the courage to ban a common substance called tannic acid and say, that is no good for the patients, and come up with something different. But to me, the most important thing that stands out, he was concerned about the holistic well-being of his patient. And I don't think in surgery we stress that enough. It's more than just a technical exercise. And for some people and some of the surgeries, it is quite fantastic. So my plea to you is when you next pick up a pair of scissors, remember that we need to hold them with reverence and respect, as that man did for his patients of the Guinea Pig Club. I'd like you now to ask questions, throw it open. I know my fellow sensei, and must congratulate Professor Seeley. We've invited her to join our team as a sensei because her passion and her understanding of the art of surgery and the holistic nature of it is exemplary. But also, she teaches on low fidelity models as well as a professor of obstetrics and gynecology. So welcome, Professor Seeley. Any questions from anybody at all? Any observations? None? I'll look in the chat. Any observations in the chat? Hi, Prof. How are you?
Hello, thank you, Prof. Yeah. Thanks for allowing me to join your team, teaching faculty as a sensei, and that is just a great honor, bro. Yeah.
Well, it's our pleasure, and I hope that we can actually bring more meaning to the teaching of basic surgical skills and the practice of skills as well. And in the same respect, I hope that we can also encourage more people to become surgeons, because certainly it's got to be one of the most privileged professions to be in.
Yeah. I have a few a tray to show you whether you can see this or not.
Oh, I love that. We've got bananas and grapes and fruits.
Yes, it's a fruit trays. Now, anytime I went to supermarket and then I got it, the fruits, then I'm thinking about it. How can I use these as your surgical training models, Prof? Yeah.
Fantastic. Well, what we discussed last week, if you weren't there,
So,
we were talking about cone biopsy of the cervix and obviously
yes,
working down the tube. And our fellow sensei, Chris Caddy, suggested that take a pear and you put a toilet roll over the top of that and see if you can take a cone biopsy at the end
yes,
of a toilet roll with an 11 blade. And I've been thinking about that. And there you go, fantastic. So how do we take an 11 blade to cut accurately the
yes.
core out of the top?
Yes, Prof. So in a cone biopsy, but the toilet, thank you very much, Prof. Chris, give me this idea of using this toilet. But in reality, it doesn't look like, I'm sorry, it's like a vagina. So I have modified a little bit with another one. Oh goodness, I got this, the yoga cup. All
Okay.
right. So it's like a kind of a funneling so that
Yes,
you are
yes,
able to
okay.
see
That
it.
looks
Yes,
fantastic.
yeah. So this
Hmm.
is with the yoga cup, or otherwise it's just a paper coffee cup that you can, you
Okay.
can use it so that it looks like a kind of a bit wider outside and then narrow
Yeah,
down to that.
yeah. I
And
like
then
that.
this pair, we can use it for the two types of cervix. This is like a small nullipara cervix,
Uh-huh.
and this will be multipara cervix in the other cervix of the pair.
Ah,
So this
interesting.
is the biggest,
Ah,
ectropion cervix. So
yes.
I will try to videotape it because I videotape with the
Hmm.
grapes for the
Yes,
peeling of the grapes, yeah.
yes,
And another model is the tomato model.
yes.
Yes, they're peeling off the tomato skin for the ovarian cystectomy. It's a successfully video recorded, but I cannot upload it. So I'm trying to get it other way to upload to your system.
Okay. I look forward to seeing that. But what you're witnessing here is creativity at work as we think about low fidelity models that will enable you to practice some of these skills. And it's only through practice
Yeah.
do
Thank you so
you
much.
actually, and
Yeah.
repeat,
Thank
do
you
you
so much.
become any good with the skills? And the thing about the low fidelity models that we've demonstrated this evening, they give you the proper haptic feedback. The other thing is they show you when you're going wrong. So doing it live, you can see when I breached the edge of that tangerine. Can't make it up. But that's what will happen when you're in surgery. It causes bleeding. So I'm hoping that Professor Sile and a fellow sensei can join us next week to talk further about this holistic element of surgery, but also careers in surgery, particularly for women. So I'm waiting to hear if we can do that. Otherwise, we'll schedule it till another time. I'm going to be in Edinburgh next week, but back on the 9th of June, and we will discuss in detail the dissection, bringing together the knife and the scissors, and we'll dissect out the femoral canal of a chicken leg. That is always good fun, and I thoroughly enjoy. I'd like to thank Dr. Aprajita on the production side. My regular viewer is Dr. John Rudd, who's actually online. And thank you, the audience, for participating. Do answer the feedback form, because we are going to make our CPD certificate, because you're accredited by the Royal College of Surgeons of Edinburgh and the Academy of Medicine of Malaysia. We are going to make a conditional to get a CPD form, and one CPD point. We would like feedback from you. We do listen, we do learn, and we look forward to hearing from you. Thank you very much for joining us. Keep well and see you next time. Thank you.